right, welcome. Welcome, everyone. Welcome. If you have not told your friend to sign up, tell them now to sign up, because this is the time to have all of your questions answered about COVID-19. We have to keep us safe, our community safe, and our family safe, and we have the time to do it. I want to welcome everyone to the Urban League's Boost Your COVID Knowledge event. I am Dr. Seanelle Hawkins, and I have the pleasure of serving as the president and CEO of the Urban League of Rochester. But today I am not here alone. Here with me today are my sister and brother CEOs from all of the New York State Urban League affiliates. So today with me is Arva Rice from the New York Urban League. We have Savoya Samson from the Urban League of Westchester County. We have Thomas Buford from the Buffalo Urban League. We have Jennifer Lesko from Broome County Urban League, and the Teresa Sanders from the Urban League of all of Long Island. So I just want to say thank you to my sister and brother CEOs for just working collectively to put our community first and make sure we give them the information that they need to stay safe. So today we have a panel of medical professionals that we are anxious to hear from. And we have your questions. These are questions that came from the community about COVID-19, its variants. And before we do that, I want to introduce two very special guests. I am delighted because we have the opportunity to have Marc Morial. And Marc Morial is the president and CEO of the National Urban League. So Marc H. Morial, he leads Urban League is the nation's largest civil rights and advocacy organization. And today he's bringing us greetings. So I want to welcome the Marc Morial. But before we do that, I just saw that we have the Lieutenant Governor. So let me just do this in order. And so I want to thank, first of all, the Lieutenant Governor for being here, but let me give you the appropriate welcome. First of all, thank you. We're so honored to have Lieutenant Governor of the great state of New York, Brian A. Benjamin. He is the Lieutenant Governor, and he's previously served as a New York State Senator for District 30, which encompasses Harlem and East Harlem and the Upper West Side. And he's also served as the chair of the Budget and Revenue Committee. He's had many leadership roles in governance, and we are delighted that he is here with us today. Lieutenant Governor Benjamin is the leading voice in fighting for fairness as relates to criminal justice reform, public safety, affordable housing, and economic recovery. Lieutenant Governor, welcome. We are so glad that you could be here with us today.
Thank you. It's such a pleasure to be here with the Urban League, National Urban League, and all of the affiliates in New York, talking about such an important topic, boosting our COVID knowledge in our community. And it's such an important conversation to have because, quite frankly, right now, a lot of this is not a conversation. You know, you turn on the television, someone puts a commercial in your face saying, get vaccinated, get the booster. There's no conversation. People have questions. It's not easy to sort of find a trusted voice to have those kinds of questions and have those kind of communications with. And so what you're doing here tonight is so important. And so when Arva Rice asked me to attend, I made sure to find the time in my calendar because part of my portfolio as Lieutenant Governor is to deal with the issue of COVID equity and vaccine equity, which essentially is looking at particular pockets within our statewide community that are not getting vaccinated. And two places that we have detected where it is clearly the case is with younger Black men and with white rural communities, particularly men. And one of the things someone said to me the other day, well, the one thing that young Black men and some of our white rural community members, particularly Republicans, have in common is that they both distrust the government. That is a very interesting observation, but what it speaks to is because of that distrust, trusted voices have to step in and have to be able to have honest and clear dialogues. As you know, the governor recently instituted a mask or vaccine mandate. I'm sure you're going to talk about that. It's important that we can always give right answers. Some of the things that I've tried to do in my capacity as Lieutenant Governor is to help clarify when people say, "Oh, wait, what does this mean for me? What does this mean for my business? What does this mean for my life? What does it mean for my 2-year-old?" I have a almost 3-year-old. She has to wear a mask at school. That's very uncomfortable. Many of you know this who have young children and the like. But obviously, one of the things that we want to do in New York State is we want to get through COVID. We want to get through Omicron. We want to help stem the Delta variant, but we don't want to shut down the economy as well. We don't want to move. We don't want to go to a shutdown state. So the question is, how do we make sure that we deal with COVID and also continue to responsibly try to deal with reopening society in a way that's safe and put the appropriate safeguards in place when need be. But this is an important topic. Thank you so much for having it. Thank you so much for having me. And I look forward to continuing to be a part of these conversations as we move forward in New York State. And just so you know, we're also looking right now, I'm leading the COVID Equity Task Force. We're starting to talk about bringing some dollars to some targeted efforts within our communities to ensure that we are helping to stimulate the right conversations, more testing, and as well, what do we need to do to try to help drive vaccinations and boosters? It's clear to me, and I would love to see some of your thoughts on this. 5 to 11-year-olds not getting vaccinated at high rates. The numbers are very low. I was talking to the Department of Health Commissioner Mary Bassett earlier this morning about some ideas. Would love to get your sense on how we can try to ramp that in a way that is reasonable and respectful, but also is helping to protect some of our younger residents, and also just how we think about this issue of hesitancy, and do we think that's a good thing, and are we trying to address that, and how do we address that, and how does the state work with community leaders and partners like yourself to do this in a way that is in everyone's best interest? So that's sort of where we are. I can tell you that the governor is very focused on this. I'm very focused on this, and I want to make sure as we deal with COVID that it is done equitably, and that our community is given the appropriate resources and the respect that it deserves, so that we can all live productive lives.
First of all, thank you, Lieutenant Governor. And the Urban League is here to support. This is our effort here to make sure that we get people educated and get people vaccinated and keep people safe. So thank you for all that you and the governor are doing to keep New York State safe. And we know that you're busy. First of all, thank you for taking the time out. We're not going to make you stay the entire time, but we want to thank you for being here to bring greetings to us today.
Thank you.
Thank you. Next, we will hear from Marc Morial, the President and CEO of the National Urban League.
First of all, I want to wish everyone a safe and joyous holiday season. A Merry Christmas, a Happy Kwanzaa, a Happy Hanukkah, and Feliz Navidad. And in doing so, certainly we remember the too many who have lost their lives due to COVID over the last almost 2-year period. It's been tragic for the nation. It's been tragic for our community. We have struggled, we have fought, and the human toll has been exacting and challenging. But in that time, the Urban League movement stepped up to respond in many ways. First, to address food insecurity across the Urban League movement by providing groceries and support. Number two, by helping students who may not have had sufficient Wi-Fi access at home to continue with their classes. Many have gone to Urban League affiliate offices and centers around the nation. Thirdly, by standing up the All In campaign, which is our campaign to encourage and educate people about the benefits of the COVID-19 vaccine. And certainly after examination of those benefits and weighing it against any perceived risks, real or even imagined, we have strongly concluded that it is in the best interests of our community to get vaccinated. I was vaccinated 6 months ago. This past Saturday, I got my third shot, the booster shot. Thank you very much. So far, I've had no side effects, no effect on me as a result of the booster shot. And I thank you for that. And certainly take the step to encourage people to get the booster. We have to do everything we can with the weapon we have to not only, ladies and gentlemen, brothers and sisters, protect ourselves, but we're also protecting our friends, our co-workers, our family members, and our community members, of course, with the COVID-19 vaccine. But over and above that, this pandemic has also been a moment where we have been given a wake-up call when it comes to the persistence of healthcare disparities, whether it's diseases or death, whether it is the severity of diseases. We've seen with COVID-19 a disproportionate impact on Black people and other communities of color. So let this be a time when, going forward, we encourage our public health leaders, our politicians, those that run insurance companies and hospitals and medical offices, that they have got to pay more attention to and respond to and address the persistent health disparities that exist in communities and in this nation. Key to this, we all have to be well informed. Key to this is that public health infrastructure needs to be improved. Key to this is access to doctors and hospitals have to be upgraded. Key to this is for us to place self-care and self-love at the top of our personal list as we do what we can to take care of ourselves, to take care of our families, and take care of our loved ones. I call it self-care because it is self-care, and whenever we care for ourselves, we truly love ourselves. Urban League affiliates across the great state of New York, I want to thank you for the work that you've done and that you continue to do as you are on the front lines when it comes to the COVID-19 pandemic. You've done the work. We continue to do the work. We're helping people get reemployed. We're helping people access programs and benefits. We're helping small business owners try to get back on their feet. This is important work. It is the work of the Urban League movement. It is the work of empowering communities, changing lives toward a more equitable future. Once again, season greetings, happy holidays, and thanks for having me. I'm Marc Morial.
Thank you, Marc. We are delighted that you could bring greetings to us today. So next, I would like to ask my fellow Urban League CEOs to join me on stage to help introduce our panel of medical experts, but also to really help us understand what's happening in their area. So if we could bring all of the CEOs to the stage, I would be most grateful. And we'll begin with Savoya Samson.
Hello, everyone. It's a good night and happy holidays as we come along to the Christmas season. I am very excited that we're doing this here tonight, that we're coming together again as a network of affiliates across the state to address issues that are very important to our community. The last time we did it was around the issue of education. Today, it's around the issue of COVID. I am happy to say I invited and he accepted Dr. Marc Asamenew to join us today. Dr. Asamenew is the medical director for the health center in Mount Vernon, but he's the medical director for the health centers and its satellite, and he serves our most at-risk population. Currently in Westchester County, we have an infection rate as of yesterday, I'm reading it on the Westchester dashboard, of 3.7%. Many of you from around the state may know that Westchester had the containment zone, the first containment zone in the country and the first containment zone in New York, in New Rochelle. We were shell-shocked. It was terrifying, to be truly honest, in the beginning of this epidemic. And in the beginning, when we first started to see the vaccinations available, our communities were not able, members of our communities were not able to get access to the vaccine. And I know my colleagues and I around the state, we worked We work tirelessly to get access for our folks around the state, but now we're at a different sort of a position where the vaccine is available. It's readily available. It's been proven effective to stopping severe infections. And now we're seeing members of our community not necessarily availing themselves of it. In Westchester, our most diverse communities, Mount Vernon, Yonkers, White Plains, Greenburgh, are showing the lowest vaccination rate and the highest infection rates. And so I think coming together as a community, coming together across the state to figure out what's going on in our communities and what can we do as a network of affiliates to encourage our community to alleviate their fears, to let them know the truth about vaccination, and to sort of get rid of some of these myths and misunderstanding is necessary. And I am grateful that we're here tonight to come together to have this dialogue. And I welcome all the medical professionals. And Dr. Marc, thank you for joining us.
Mr. Thomas.
Yes, good evening and happy holidays to all. So excited to join this panel and share this important information. I am fortunate to have joining from the Buffalo and area communities to have Dr. Fred Archer III, who kindly accepted our invitation. Dr. Archer is a clinical assistant professor of pediatrics on the Jacobs School of Medicine here at the University of Buffalo. And he also serves as a medical director for the Niagara Street Pediatrics, and is also a dear friend. I will tell you that he's going to bring us information, as was mentioned earlier by the Lieutenant Governor, regarding where we are and the importance of the pediatric, the impact on the people in the pediatric demographic, and where we're progressing with the vaccine. I will tell you that in Buffalo, our Erie County executive had Erie County on a 4-phase plan. And we were at stage 1, which said we had this mask mandate. Stage 2 was going to be for public places, vaccine only. Stage 3 was going to take us back to limited capacity. And then if we reached stage 4, we were going to get to closures again. Fortunately, as of the last week's reporting, we started to see some relief in terms of our hospitalization and other critical factors. So we remain at stage 1 and we haven't advanced. But beyond that, I'm going to leave it to our medical professionals to put this in more context and bring us more information. Thank you all.
Thanks. Thank you, President Buford. We'll hear from Jennifer Lesko, who's the president of the Broome County Urban League.
Thank you very, very much. We're so glad to be here. And as a couple of people said.
Oh, Jennifer, you want to unmute.
I couldn't unmute myself. Okay, there we go. All right. So good evening, everybody. We're really, really happy to be here from Broome County. This is hopefully the second of many statewide collaborations that the New York Urban Leagues are going to do because it's been really positive for us to come together across the state and show that we're united and we're working together to help New York State be a better place. And so I'm really happy that Mrs. Rhonda Plunkett is here. She is an ER nurse for United Health Services Hospital. She has been on the front line of COVID since it started. She's also on our board. So, you know, I think she felt she had to do this, but she's been doing some really great work around our community. And here in Broome County, we're really working to get, as folks said, to get people to work off of the statistics and the data and not fear. So we're trying to work with some of the local churches, the NAACP, the American Civic Association, to really get a joint message out there about why it's important for us to get vaccinated, get boosted, follow the mask mandates and everything that's going on, so we can really hopefully, you know, come out of this doing okay as a community. But as far as a lot of the data, I will let, you know, Rhonda take care of that, but we're just so happy to be here. And thank you to all the medical professionals for all you do, not only during this COVID pandemic, but all you know, all the time. We just thank you for your support. Thank you.
Thank you. Next, we'll hear from Arva Rice, and then we'll hear from Teresa Sanders. And if Arva's not ready, we'll go right to Teresa Sanders just to bring a quick welcome. Yes.
Hello, everyone. Thank you so much for asking me to join on this panel. It's always great to be with my fellow CEOs as we work on these issues in the community. This new normal that we're in is not even normal anymore. I don't know why we keep calling it the new normal. We're just using that terminology. But I think today's discussion is going to help us alleviate some of the myths that exist in the community. It is my hope that we will get some people to really make that decision, move towards a vaccination in a safer way of life. All of the things that you hear, whether it's in the barbershop or getting your nails done or the beauty parlor, now is the time to get it from the experts. Tonight is the night. And we appreciate you all coming on so that you can provide valid information. And once again, thank you, my fellow CEOs, for making sure that this happened.
Thank you, thank you, thank you. Now, I just want to make sure that I make room just to remind you all that we are sharing this out to everyone via Facebook. This will be on every affiliate's page. So I just want to share that with everyone. But I wanted to also introduce Dr. Julian L. Watkins. He is the Health Equity Advisor of New York City Department of Health, and I'm so glad that he's here. So let me just go ahead and introduce the panel because we don't want to delay any further, and I'll introduce all of the folks, but I am delighted to bring Dr. Michael Mendoza, and he is the Monroe County Public Health Commissioner, and he's the 9th commissioner, and we are glad to have him here today. He will talk about what's happening in Rochester. I will not do that. But before that, let me introduce everyone. We have Dr. Markos Asamenew. He is a physician, and he is out of Mount Vernon Neighborhood Health Center. We also have, as I mentioned, Dr. Julian L. Watkins, who is a health equity advisor with New York City DOH, and we're happy that he's here. We have Nurse Rhonda Plunkett, and she is an ER nurse with United Health Services in Broome County, and Dr. Fred Archer III, who's assistant professor of pediatric, and he works at the Department of Pediatrics for the Jacobs School of Medicine and Biomedical Sciences. Welcome to this panel. Hopefully I have not forgotten anyone. So let's just get right into it because we don't want to delay. Again, thank you all for your thought leadership and your expertise. We have lots of questions. So I want to get into right now, let's just talk about what's happening. Obviously, we're all from New York State, and the coronavirus has impacted our zip codes very differently. Can you each talk about your specific area and your priorities for fighting COVID-19 today? And of course, I'm going to start with Dr. Mendoza, and then I'm going to go with Dr. Watkins.
Thank you, Dr. Sean. Here in Rochester, as many of you know, we suffer from some of the greatest disparities in terms of health outcomes, and that pretty strongly parallels disparities in terms of wealth and race ethnicity. So, we're doing quite well in a number of our areas, but I took this job because I care about the underserved and those who are traditionally marginalized. And so right now that's, the inner city of Rochester and a fair bit of our rural areas. When we think of poverty, we often think about the inner city and urban areas, but I think it's also important to think about rural areas because rural areas have been traditionally underserved in very different ways for very different reasons. But when we're looking at a pandemic like this, we need to focus on those underserved areas. So when we look at vaccination rates in the urban areas, they very much parallel, unfortunately, the hospitalization rates. When the vaccine rates are low, the hospitalization rates are high. And the same is true in the rural areas. And that's particularly important now because we are dealing with a Delta variant, which has been the dominant variant since the summertime. But as all of you know, the Omicron variant is on the wings. And there is still now some emerging science that is showing that it is highly, highly transmissible, very, very contagious. But thankfully, hopefully, it won't cause severe illness like Delta did. Now, the unfortunate thing is that we can't really sit back on our heels and say, well, it's not going to be as bad, because if it's much more contagious, then you're going to see a lot more people getting sick. So it's a different kind of beast, but we have to remain vigilant. And I think, to those who say, well, you've been working at this now for months, at what point do you say, time to give up? And I say, I'm not there. I don't think we should ever be there. Had it not been for our efforts in the city of Rochester, we wouldn't have had, multiple thousands of people getting their first dose over the last several months, during that period of time when people said, these people, they don't want it, that, just give up. I don't think that's appropriate. I think, we in public service need to remember that every member of our community deserves access to science-based, evidence-based treatment and prevention. And from my standpoint, we're not done until we're all done.
Thank you, Dr. Mendoza, and thank you for sharing what we've been doing in Rochester. I want to bring Dr. Watkins on so he can talk about what are you seeing similar things in New York City? If you can talk about that, please.
Yeah, thanks. Happy to be here. Yeah, in New York City, we're also seeing some of these worrying trends across some of the main factors that we keep an eye on. Specifically, hospitalizations are going up. We're also seeing the percent positivity going up is around 5% right now citywide. So we are seeing some concerning signs. Luckily, we're not seeing steep increases in death rates across the city, which I think is another important indicator to keep an eye on. But yes, New York City, we're definitely posed and positioned to be able to respond to this new Omicron variant. We're able to test, sequence rather, around 15% of all the positive tests that come through in the city, which is a lot higher than the national average, which I think is really important for surveillance of this Omicron variant. But even as we, as the numbers aren't super high, we're acting as if it's here. I think we believe that there is neighborhoods, that there's community spread. And so just today, our mayor, our commissioner of health, and the lead for our New York City Test and Trace Corps, they had a big press conference and released a six-point plan of how the city's going to address some of the, this rising, that's fourth wave by now, and it was released on our DOHMH website. Encourage folks to go check it out. Even if you live outside of New York City, the guidance is really important in terms of keeping folks safe. I think a big part of the work that I've been doing also, to really open up that discussion around health equity has been around getting resources to folks. And so, the city has plans to distribute, 500,000 at-home testing kits. We're also distributing high quality KN95 masks to our most vulnerable New Yorkers, not just at, big city sites or giving out to first come, first serve, but really focusing on community-based organizations and other places for folks who are the most at risk. So, happy to be here and get into this discussion a little bit deeper.
All right, well, let's hear from Nurse Plunkett, and then I want all of you on the screen in a little while so we can just have this conversation. But if Nurse Plunkett could talk about what she's seeing in the emergency rooms. You're on mute, Nurse Plunkett.
Okay, I'm sorry. Hi, my name is Rhonda. I am a nurse at UHS Hospital, and I've been for quite a few years. And I spent some time initially when COVID started being what we called a COVID nurse / PPE nurse in the beginning. And I've gone back to my regular job and just kind of incorporated that. But what we are seeing in my facility and what makes it difficult is we are a small community. So we only have really 2 hospitals. And with that, we have 400, 500 or so beds, and we are making beds where beds have never, ever been thought to be, just so that we can accommodate people with COVID and additionally accommodate people who are actually sick. So we face a huge challenge, which I'm sure other, even in larger places are facing too, but we face it even more because we only have 2 resources to which to draw from. And what we have is we have a lot of people unvaccinated still, a lot of people coming in that are not educated about COVID, and they are sick and they don't want to believe it. They choose not to believe it. Even just as of yesterday, a lady wanted to educate me to let me know about COVID because we were putting a virus in there to kill people. And like I said, I come from a small community, and this is the thought a lot within this community. And it's sad whether we're serving the people who have resources or the ones with under resources. The general mentality is the same, and it's unfortunate because it all stems around liberties. So we fight an uphill battle every day to do the educational piece at my job on what COVID is about in the numbers and how to protect yourself and how to get people to buy into that. But from the level of being on the board at the Broome County Urban League, we also talked about, and we have spoke up about things of how we can then branch off and do smaller things in the community and maybe help target that. Because here in my community, we kind of do a general thing and it's not really targeted. You'll see the commercial and it doesn't have any impact, I mean, at all. I mean, see them, I'm like, I think that was a COVID commercial, but it's not really, I don't think it's reaching anybody. People are just seeing it. And the biggest thing, and one of the biggest challenges we have is COVID fatigue. So, any information that I can, and when I can, we were always out there trying to share it. And, we try to share it in ways that people will understand it. You get people with a whole lot of big statistics. Sometimes it just goes straight over their head and they don't want to hear that. You have to really bring it down to I'm going to bring this right to your door
Absolutely.
level.
And that's what we hope to do today, get the community members educated. So let's bring Dr. Asamenew on. And if he can talk about what he's seeing in Mount Vernon, and then we can, after he's done it, we can have all of the medical team on, because I really want to get into some conversation and ask the questions that people really want to get into. I think that Nurse Plunkett is right. People are starting to feel fatigue, but we need to educate each other so that we understand what's next. So Dr. Asamenew, thank you for being here. Talk about what you're seeing.
Thank you for inviting me. Just for historical perspective, I don't know if you remember, the first COVID in Westchester was in New Rochelle. It was a lawyer that had it. And I remember in our community, all my patients used to say, it doesn't affect Black people. That's the beginning of it. So a lot of people thought that it doesn't affect Black people at all. So there was a lot of resistance in anything at all, even hearing about the COVID initially. So that's one of the biggest problems that we had. So we knew we had to start educating the public right away. So in support with our CEO, Ms. Watson, in collaboration with New York State Department of Health, we built the first outside testing center in Mount Vernon. And that was basically very, very successful actually testing. We're testing about like 300, 400 patients a day. That helped actually reduce the mortality and infection rate. But still, the African population, African American as well as Spanish population in our area is very, very high infection rate and also resistance to the vaccine. So in terms of also like pediatric vaccine, I don't know if anybody remembered, the governor came, I think, at the beginning of this month, to encourage, to promote the children's vaccine. And so far we've been successful. I believe right now we have about maybe 120 kids were vaccinated recently. So we're building that. We're also going to the community in the apartment buildings, community centers, churches, vaccinating people. The most important thing we found out is education, education, education. There's a lot of resistance. People have different opinions. Some say like certain kind of route treats the COVID. So they mix up these things from Caribbean countries. They say it cures them. All this misinformation. So we have a lot of challenges. But right now, for example, I was looking at the statistics today. So Raja mentioned it, like Westchester had a 4.8% infection rate, which is up from, I believe, 2 weeks ago, it was around 3.2%. So we have a long way to go. So hopefully we educate the public, to do more vaccination and testing for that matter too.
Thank you, Dr. Asamenew. Dr. Archer, you're serving youth, you're a pediatrician. As we're talking about the COVID-19 vaccine, let's talk about getting youth vaccinated and the low rates. But let me just ask the question that everyone wants to know. Dr. Archer, do you have children?
Yes, I do.
Are your children vaccinated?
They are at this time.
Okay, awesome.
So just to get that out there.
Let's just get that out the way because we wanted to know. We want to know.
And as a pediatrician, you guys are only going to get one thing from me. I'm a pediatrician. We deal in vaccines all the time. So we're 100% behind this.
So why are the rates so low for youth? Can you talk about what you're seeing?
I can tell you at least right now, just from the data in Erie County alone, about maybe a quarter of the kids, about 26% of all the kids from 5 to 11 currently at least have their first dose of the vaccine. So part of the reason why the rates are so low is that we just recently got approval for the 5 to 11 age range. And just before that, we recently had just the 12 to 18 age range. So because we were essentially late to the game and getting it approved for those kids, those rates are on the upswing, but they're taking longer. The push has been out there initially just to get every adult you can find vaccinated, and we've been vaccinating adults longer. So we're taking a little bit of time to get the kids up to speed. And like with anything with families and kids and vaccinations, you're going to have folks that are going to be concerned. It's something new. It's something new going into my child. So a lot of families are going to just have some reluctance with that. Being pediatricians, we are used to dealing with vaccine hesitancy. So the first thing is making sure that the vaccine is available. And right now, all the Erie County Department of Health sites have the Pfizer vaccine available from ages for the 5 to 11-year-olds with the appropriate size dose for them, the 10 microgram dose, which is the smaller dose than the adults. The other thing that we've been doing recently is working a lot with the schools and making sure that we have school-based health clinics that kids are able to get the vaccines in the schools. Just within the past 2 weeks, many of our school systems have gotten the vaccine on site there. So it's just another avenue rather than going to a county site, going to your child's pediatrician, you can go to their school and the kids can get the vaccines there.
So I'm asking that all of the medical professionals are on the screen now because I want to have this conversation that everyone wants to know. So I'm vaccinated, I'm boosted, but I'm still at risk of getting COVID. So why get vaccinated? Can one of you answer that question? Because people want to know, why should I get vaccinated if I'm still at risk of getting COVID?
So I'll start by saying that the vaccine never promised that you would never get COVID. The point of the vaccine was to help people not get sick. That's the most important way to say it.
I don't think I've heard that before. Say that again, because
let's just make it clear right here.
Yes.
Yeah, so getting the infection is one thing, but we're really not as concerned about getting a mild infection as we are about somebody who's getting a serious infection that will land them in the hospital or in the ICU. Nobody wants to get COVID. Nobody wants anybody else to get COVID. But we have a vaccine that's very effective at preventing serious illness and worse. And so that's the reason to get it. The other reason to get it is if you're vaccinated, not only will you have better outcomes if you get the infection, but you're also less likely to transmit it to other people. And so it's help yourself, help your neighbor. And as we look ahead to the holidays, this is probably the most important gift that we can give to our loved ones, is the gift of health and safety and the ability to enjoy one another's fellowship and company in the peace of our homes and not have to worry unnecessarily. You know, people have fears, and I understand that. This is a very uncertain time. But all I can say is let's take control over the things that we have control over. And right now, if we can get the vaccines and as many people's arms as we can, we will go a long way toward decreasing the chances of serious illness. And that's what everybody wants to prevent.
Wow, that is powerful. I just need to pause on that because one, no one ever said that. And I think people have mixed messaging. You thought that if you got the vaccine that you wouldn't get COVID, and people were very surprised that there was big breakthrough COVID. But what you said is just powerful, and giving people the gift of not passing it along is powerful. And I just appreciate you just making it plain to us, Dr. Mendoza. So let's continue to talk about the vaccine, because what does fully vaccinated mean today? Does that mean the booster too? Am I fully vaccinated if you have just the 2 doses? What does that mean?
Basically, fully vaccinated means once you get the vaccine, the 2 doses for Pfizer and the Moderna, and the dose for 1 dose for Johnson & Johnson, 2 weeks after your second dose or the first dose of Johnson & Johnson, supposedly you are fully vaccinated. So we are protected at least from the infection. But I think to add to Dr. Mendoza's point, one of the things people have to realize is that if you don't get vaccinated, death rate is high. Basically, the death rate is high. So that's the difference. If you get vaccinated, you know, less likely you're not going to die from it. So that's what I want to make a point on that.
So one, we're protecting ourselves from death. So what about the booster? So do I need to get this booster? Talk a little bit about Dr. Mendoza, Dr. Archer, Dr. Watkins, I'm sorry. Please talk about why the booster. Why is the booster so important? So let me just ask this question too. if I have 2 doses, am I still safe from possible death? And if I don't get that 3rd dose, am I closer to death? So help us understand what's happening.
I can start.
Okay.
Yeah, so when we're talking about boosters, I think it's and vaccinated, fully vaxxed, right? At the end of the day, I think it's really important that we do just acknowledge that this is a rapidly evolving situation. And the medical guidance is based on what is going on right now at this moment. And the recommendations are based on the evidence in that moment, right? Early in the vaccine campaign, people were questioning, like, will I need a booster? What does it mean? How long does it last? We know these things now, right? So we know that after around 6 months, after getting fully vaccinated with the 2 shots with the mRNA vaccines, and after around 2 months after getting the Johnson & Johnson vaccine, that there can be some waning of immunity, which means your protection can start to go down a little bit. So we know that those folks benefit from getting that extra boost so that we can have that level of protection up there. I think in light of these new developments, the Delta variant has come out within the last year since we started the vaccine campaign, and the Omicron variant, it's reassuring that even with these newer variants, that these vaccines are still holding up and helping to prevent, hospitalization, serious illness, and death.
Dr. Watkins has definitely said things incredibly eloquently right on that. One thing that I find just in talking to families about that is I use a lot of analogies and examples. And people are very familiar with the fact that every 10 years, I need a tetanus booster. And so when I start to think in terms, and when I explain that to them, it's because, as Dr. Watkins correctly said, the immunity, my antibodies, it starts to drop down after a while. So I want to just kind of top it off the same way you want to do with your bank account. So when I tell people with just like with the tetanus, you want to get that every 10 years just to make sure you've got that proper level. That has been something that's worked very well with us when talking to some of our parents about making sure they get that booster. Starting to drop down, you want to make sure your levels are up so you can fight off against these new variants that are coming through. And it's good that the current data is showing that the booster is what's really kind of showing some evidence of protection against at least the Omicron that's coming down the pike. Again, that is early, and we're looking at things as they evolve.
Okay, so you said it's early. So is it too early to assume that a 4th dose is going to be needed?
That's a loaded question. And I honestly, I think I'll step out there. I would say it is too early. I would not be surprised if one is recommended. And I think that's medically a very safe answer, just from what we are currently seeing and the current process of how it's evolved so far.
I would concur with that. And the reality is, to some degree, we hold the answer to that question literally in our hands. If we can get more of our population vaccinated, and quite frankly, we've got to pay attention to other parts of the globe. If we can mount a global effort to vaccinate as much as we can, that will, nip any future variants in the bud. But as we saw with Delta, it arose in a country that was highly densely populated and very under-vaccinated. Now we're seeing Omicron with the same thing. We're running out of continents, frankly, and I hope that if we can get all of our continents vaccinated, then we can put an end to this thing. But I would say that, we don't have to sit here waiting. We can work together and get this thing done. And that means that we've got to reach across the pond and reach out to other parts of the world.
Thank you for highlighting the importance of getting vaccinated, especially as you've already mentioned the holiday season. And so let's just quickly talk about how do we treat each other, treat folks that are coming to your home, or if you're visiting the home. And I'm sure you all are concerned about COVID rates going up after the Christmas holiday. So let's talk about that. How should we treat booster guests? Should we still wear masks? What are your recommendations? How do we treat vaccinated guests that just have the 2 doses? And then obviously, what do we do? Do we not invite folks that are not vaccinated? So just give us your recommendation.
Yeah, Dr. Asamenew. Go ahead, Doctor.
Go ahead. I'll just say, I think to start, there's some guidance that is evergreen or something that's never going to go out of style, especially in times where there's rates of high transmission. Wearing a mask, getting tested, staying home if you're sick, those are the things that we'll never change that guidance when we're seeing a lot of community transmission. Thinking about the holidays in light of this new variant that's circulating, that is shown to have some breakthrough. I think it's really important that folks do with the tools that we have, all of the tools, that we kind of find what is the best approach, right? Each individual may have different needs, may have different levels of protection, and may have different risks. It's really important for folks to have that conversation with your family. Talk about it. Who's at risk? Do we want to make sure that grandma or grandpa are safer over here? Or like, who's not vaccinated? Who's boosted? I think it's about having those conversations and really getting to the fact that, we're a community, we're a village, we got to keep ourselves safe, and not being afraid to have that conversation, because at the end of the day, this pandemic is still going on. And for some folks, it's really life and death, these questions.
I just want to add something. Some of the patients ask me a lot of these questions. That, for example, they said, "Oh, but virus can't grow on the ground," and things like that. But one thing I think I try to explain to the patients is that, the only way the virus survives is either the human host or animal host. For example, bacteria grows all over. The bacteria goes in food and ground on the surface. But viruses, in order to grow, they need human host or animal host. So that's why vaccination is important. Once you get vaccinated, you stop it on the track. So that way you don't transmit it. So that's why I think people understand why they have to get vaccinated, because they are the source. They're going to be the source of the infection to their parents, to their friends, and so forth.
So question about that, because we talked about the vaccine, us not being able to transmit. So if I'm boosted or if I'm vaccinated, do I still need to quarantine since I can't pass the virus?
So because we don't know who among those who are vaccinated who become exposed might pass it, we've got to take some precautions. Those who are unvaccinated and in contact or close contact with somebody who has COVID are much more likely. So those people will be quarantined. That means that those people are well, but they have a risk for getting sick. So we got to keep them inside so we can observe to make sure that they don't spread it to others. They're still well, but we got to observe them. And that's what quarantine is. People who are vaccinated, they can still spread it, but the chance of doing that is much, much lower. So we don't officially quarantine them, but we still tell everybody to pay attention to your symptoms. There is no perfect path through this. There's going to be, imperfections on both sides. And, like Dr. Archer, I like using analogies too. Every winter, many people put snow tires on their car. Now, snow tire doesn't prevent you from having an accident, but it certainly helps you keep control of things. And after a while, you got to replace your snow tires. So that's like the booster. Every so often, we're going to have to get new snow tires. They don't make the chance of an accident zero, but they certainly help. But if you don't even have snow tires, then you're really in the highest risk category. So you got to be extra careful. And so the more steps that you can take to stack the odds in your favor, the less you have to worry. And that's ultimately what we want, especially going into the holiday.
So Dr. Mendoza, just to add, so if you have the booster, you can still get COVID.
It's theoretically possible, but I'll tell you, having been in the hospital last week taking care of people with COVID, I didn't have a single person who was boosted in the hospital. Had a number of people who were vaccinated that were eligible for their booster. A couple of them, they were in the hospital for a couple of days and they went home and they're back to good. But those that were not vaccinated ever, that's who were in the hospital the whole week. So, it's technically possible, I think, for you to get the infection once you have the booster, but most people haven't had their booster for more than a month or two at this point. So getting your booster right now is really going to carry you through January, which we all think is going to be, potentially a pretty stressful time with the Omicron variant coming up to our shores. So I think now is the time to get the booster if you're eligible.
Absolutely. And I want to say for those that are watching now, we will have links on where you can get your booster or your first or second vaccine immediately following this, because we want to make sure that people get educated and get vaccinated so we can keep everyone safe. So let's talk about just how people are taking vitamins and natural supplements to fight COVID. People, their natural remedies, people say, can we debunk the myths? Are there other ways to fight COVID beyond the vaccine?
I could start.
Okay.
Go ahead. Go for it, sir. Jump in. Go.
I love that you all are just into it. Thank you so much.
I'll say this, I think that when I talk to communities, I think that communities do bring a lot of insight, years of knowledge, a lot of encyclopedias of knowledge and experience, and people who have existed and kept themselves safe for a long time. And I think that that's really great, and that can be helpful, eating your greens, sleeping well, hanging out with family and other practices, but it's not either or. We got to kind of stop the either or of it all. It's like, what are all the things that we can do? And if your herbs are helping you, that's great. But we do have this science and this evidence that can also be added to what you're doing. And so it's not recommended to really lean into some of these more traditional practices, just because the evidence is not really supporting the major impact the same way that we see with these vaccines. These vaccines are extremely impressive, they're extremely safe, and they're really effective. And so it's a combination of what are all the things that we can do, and respect that people do come from different experiences, and it's not either or, it's what's the full picture.
Thank you, Dr. Watkins. Dr. Archer.
Dr. Watkins, again, that was well said, because multiple folks have a huge history of things that have worked in their communities before we had our science that we have now. And one thing that is always good to remind people is science is just a way that we're using to understand the natural world and to improve upon things that already exist in nature. No one is going to argue with eating your fruits and vegetables, drinking plenty of water, getting enough sleep. All that does is keep the body healthy. A healthy body is already has a greater chance of fighting off something that's infecting it. So we spend a lot of time talking to our parents and our families and saying, no, take your vitamins, eat your vegetables, good, please do that. But that's not the be all and end all, and that's not actually going to get you through all of this. If you have strep throat, you're not going to just sit there and gargle with some echinacea. It's not going to take care of your strep throat. You need some penicillin, okay? Which something that science came up with, adapted from nature. And a lot of folks that we deal with, that we talk to, that have a lot of, that's like to stick with things that are natural, I always like to remind them that the Egyptians used to make a tea out of a plant that grew along the Nile that would, take care of your pain and bring down your fever. A couple centuries later, we found out that what was in that bark was something called salicylic acid. When if you add on a little chemical group to that, it makes something called acetyl salicylic acid, which is aspirin. Okay, so we understand things come from the natural world, but what we use with our brains, which the good Lord gave us, is to help the things that exist there to work at a better level. So when you tell people that that's all we're doing, we're taking what exists and then making it work even better, target it better, make it work more efficiently with the body you already have, people sit there and go like, oh, I didn't really think of it that way. And so when you have that conversation, you don't take away what they already have, you're adding on to it. And building is always better than tearing down.
I agree with that so 100%, because from a nursing perspective, we are really in that mode of teaching patients things. And as soon as I find out that somebody is into other avenues of wellness, I never disparage that or try to take away from it. But I said, it takes all these things to make you healthy. If this is what you've been doing and you felt it has been maintaining your health, then I'm going to say continue to do that. But I'm also going to say that these are also the things that you need, because it takes more than that. Because if it was just that, we wouldn't be having this conversation.
Dr. Mendoza, you were going to add to that? That is good. Thank you, Nurse.
Nurse Plunkett took the words right out of my mouth. Thank you.
Awesome. She's awesome. Well, let's talk about aftercare, because there are folks that did wait to get vaccinated, and some people are now finding themselves with COVID. What are some things that we're finding where I've seen the science with new pills that can treat COVID after you get COVID? Can you talk about that? What are your opinions on that? And what should people do? I mean, I understand you, Dr. Mendoza, Dr. Archer, Dr. Watkins, you all made it clear that you can die from COVID. So I'm not sure why we want to take that risk, but what happens? What's the aftercare?
So I'll start first by saying we don't want to alienate people. We don't want to make them feel guilty or sorry that they didn't get their vaccine. People make or don't make decisions based on a number of things. But at the end of the day, in the medical profession, we will take care of you no matter what. And I think, in a time of potential vulnerability like that, I think a lot of my patients who realize that they should have gotten the vaccine, they don't need me to tell them you should have gotten the vaccine. They know that. They want me to reach out with an open hand and say, we're going to take care of you. We're going to make sure that we have all of the information you need to make a healthy decision from this point forward. And if that means medications to prevent blood clots, if it means making sure that you get a vaccine after you have real COVID infection, we have those conversations. There are new treatments in the wings. There's monoclonal antibody treatment. There are new antivirals that are being studied very rigorously across the globe and being put through all of the same processes that we put every drug through. So to those who say that it's happening fast, the answer is it's true. It's happening fast, but we're not cutting any corners. But I think my most important message here is that we treat people with love and respect no matter what. And just because you have COVID doesn't mean you're less of a person to me.
Powerful. That is powerful.
And we have people a lot. Like I said, I come from a small community, which makes it difficult because a thing I hear a lot is people say, I don't believe in COVID. So when I'm trying to get them to that next step, because I got things that I need to do that would be beneficial to them, one of the things I do is I have to address, first of all, what information they have, their fears. And then I've just bluntly told people many times, I said, I understand you don't believe in COVID, but I will tell you COVID believes in you because you have it. So what we need to do is start here. I don't care, like you said, I don't care about why you did, I don't want to make anybody feel guilty, but I want to make you feel better. And I want you not to have to worry about passing this on to someone else. So for me, a lot of the things are trying to address some of the core things that they have within them that made them not do it. And a lot of times it's about fear and misinformation.
Dr. Archer, you were going to add to that? Or Dr. Asamenew, I'm sorry.
No, I agree with Rhonda. Definitely you have to support them. There's a lot of fear. As a matter of fact, in our clinic, even nurses, they were scared to get the vaccine. They refused to get the vaccine until we finally mandated and said, if you don't get the vaccine, then you don't work. So we have to really work hard to not to criticize them, but to educate them, the safety of the vaccine. And by giving example too. As a matter of fact, one of the pastor who was a big pastor at the church, he was the first one to get the vaccine, and his congregation start to get the vaccine after he gets it. So we have to do it by example also, that's safe.
So go ahead, Dr. Archer, you're going to add, go ahead.
No, I'll talk y'all's ear off tonight, and I do apologize for that.
We want that. This is the conversation that we all need to have, and these are the questions that we haven't had access. So thank you for taking the time to do this on an evening. We appreciate you and we feel the love. So keep it coming.
Well, I definitely want to say I'm glad we do have nursing involved in the panel, because this is really an all hands on deck type of once in a generation event. So we need nurses, we need nurse practitioners, we need PAs, MAs, physicians, both MDs and DOs. We need everybody on board for this. So I'm very glad that we have nursing represented on here. I am very glad that you told people that COVID believes in you. I have said that I don't know how many times. So I'm glad that word is getting out there. When it comes to the issue of treatment for folks that were not vaccinated, but then eventually have COVID, I'm glad we have those available for them, because we need to use every tool that we have in our belt. And the key thing is, when you're talking to folks, would you rather have to deal with the treatment after the fact? And you really want medicine, at least from a primary care standpoint, which is the realm that I live in, is about prevention. So what can we do ahead of time to keep you from needing to have to do that? And it's available, but let's do the vaccination first. Let's try and do these other methods first before we do that. But letting people know that they are available, and every treatment comes, with risks and benefits. But we'd rather try and do prevention rather than have to talk to you afterwards. But again, really meeting people where they are and respecting that their fears, even though they might seem illogical to us, are very real to them. But the only thing that conquers fear is knowledge. And our job is to provide that knowledge to people. And a lot of times it depends on who they're hearing it from. So the fact that we have people on this panel here that look like the patients they take care of is so gigantic and huge, I can't even begin. That is the best way to reach these groups. When I say these groups, we're part of these groups, to reach people that look like us and take care, and we're taking care of each other. And that's a beautiful thing. And I don't want to take away from the empathy that other people from other backgrounds have, because in healthcare, the human body is a human body. It doesn't really matter what you look like in the skin you're wrapped in. but we got to look out for each other. And the fact that we're here, I know that there's some patients that will listen to the providers on this call differently than they may listen to some people. And so it's very good to see that, when you think there's a conspiracy out there, so either I'm in on the conspiracy, or I'm actually trying to give you some real information.
And thank you for the real information. I think today what I'm hearing is so much empathy and compassion for just caring for the people you serve. And I really appreciate that. So on behalf of all the folks that just didn't hear it the same way, we hear you. We absolutely hear you, and we appreciate the compassion and your passion for serving others. But I want to talk about, because we don't talk about what happens after you get COVID. People say, oh, I had COVID, I survived COVID, but there's some long-term effects. Can you talk about what you've seen, or what you are seeing, or what we need to be concerned about?
I could hop in. I think that there's this conversation around this a syndrome that we're calling long haul COVID. I think that's something that we should really be concerned about. These are people who after the acute infection, they have lingering symptoms, some of them lasting for months, for over a year. People are having, it can look like a broad variety of things. People have neurological symptoms, confusion, or I can't remember things the way I used to. People have chest pain, people have difficulty breathing, people just feel like they're not the same. And unfortunately, people who look like us, when we present to hospitals with these symptoms that are vague or here or there, a lot of times we don't get the care that we need. And seeing how common this is, about one in 3 people who get COVID are having these symptoms. That's a lot of people. And so just raising an awareness that for some folks, there are these long-term things, and that is something to be mindful of as we make these decisions about whether to get vaccinated or not, whether to go on these family trips, really factoring in and knowing that some folks are dealing with this new chronic illness that we're still trying to learn about. And we learn more and more, day by day.
Thank you,
It's very important that, because I see a lot of patients who complain about these symptoms, but they tell me, like, when they go to other doctors, they say, oh, you're just thinking about it, don't worry about it, but it's real. So we have to be empathetic and try to understand, where they are coming from, to be supportive. As a matter of fact, we have increased our behavioral health support system, social service department. We are helping those patients who go into depression and anxiety because of this disease.
Oh, Doctor, I'm so glad you brought up the mental health aspect, because, when we sit here talking about the fact that we're all tired of COVID, it's not just that we're, physically exhausted, but we're mentally exhausted. And, from a healthcare standpoint, we're all done with it. And if we're done with it, I know that the lay public is as well. And people don't realize that in addition to a lot of the physical ailments that people are dealing with following COVID, the mental health aspect of just the isolation, just the constant state of fear. You've got all my stimulants are just running high the entire time, and living in that environment week after month, and now going on years is huge. So when people do come in, addressing that mental health component, just asking, how are you feeling? I mean, no, like, really, how are you doing? And making sure that they have access to those resources. We definitely can deal with the physical complications afterwards. And I know we'll get into some of the cardiac manifestation. We'll get into all that. But the mental health aspect is gigantic. And I'm very glad that groups like the Urban League are involved in making sure that mental health is getting to the urban areas, some of these very deep rural areas where it's very needed, where folks just don't have the access. And providers are themselves getting up to speed with not just being able to talk to people about it, but recognize the symptoms. A lot of providers don't even, it's not even on their radar, but many, many, many more are becoming just aware of these things. And groups like this, webinars like this, are not just good for the public, but they're good for providers to just find out where a lot of these resources are available.
Coming from the ER, again, about the whole teaching aspect, it's good to hear, from providers that are actually like working with their patients. Unfortunately, like when you get in the ER, everything's like quick, down and dirty. So you don't get, our physicians, unfortunately, are not giving a lot of education. So then it does fall back, really to the nurses. And we have to make doctors aware. I mean, I've made doctors aware plenty of times. And sat there until they listened to me. The reason why they're not doing this is because we're not giving him the answers that he needs. And he's fearful. I said, I feel like I almost got him there, but he's not quite there, so what can you do to, work with me to help him get him there, to get a better understanding on why this is important, and that we understand that people don't, like people say, like, I'm afraid to go out anywhere, I'm afraid to do anything. Oh, I don't do this, I don't do that. And I say, well, that's not what's necessary. I said, what is necessary is finding out about COVID and understanding how you can live with it within your life, because we are going to have to learn to live with this, and we can. And the ways that we can do that is first educating ourselves and protecting ourselves. And then I talk about the ways in which we can protect. I said, if you have fear of the vaccine right now and you want a little more information, let me give you some. But in the meantime, how about you wear your mask? How about you make sure that you wash your hands? How about that before you allow people within your circle, you make sure that they are well, or if they're not somebody who's normally in your circle, then maybe you just have that conversation on the phone. I said, even these things can help us kind of reduce COVID and get more people educated, and then maybe help you feel better about feeling like you have to be like in your house and not touch anything or touch anybody. I said, that's not the way to do it. I said, but the most important thing is, how can I help you understand something about the vaccine and what it will do? Or let me share with you what I know about people who have not been vaccinated, what they have gone through, and what some of them are still going through. So like, I try to give people like as much information on a level in which I think they can understand. Pretty simple. I like to use a lot of examples, but I try to meet them where they're at. And if I can't get them to get vaccinated that day, then assure me that you will at least wear a mask, and that you will at least hand wash, and you will try to avoid crowded situations. I'm not saying don't live life, please live. And that's why I'm here. I want you to live, but let's try to live smart.
Thank you, Nurse Plunkett. I want to talk about youth, but before we do, let's just talk about why we're here today. One is the importance of helping people understand the importance of getting educated about COVID-19, the vaccines, the variants. But also I wanted to, are we in this situation because we all got relaxed? Did we stop washing hands? Did we stop? How did we get here? Even, I'm thinking that all of us may have just forgotten. I don't know, but can we talk about how are we back in this place again? Dr. Watkins, you look like you're ready to answer.
I think it's worth mentioning and naming that, our people, Black and African American people, or some folks, some of the categories or ethnic groups that have some of the lowest vaccine rates. But there's a lot of progress that's being made. But I think we should name that we live in this country, in a society where we've been exposed to the oldest misinformation, right? We've been been living in a system and experiencing systems that say that white people are superior. White supremacy is the ultimate misinformation. And if we don't address that and the effects that living in a white supremacist, capitalist, patriarchal society does to us, like, people can't trust health departments because health departments haven't proven to do right by us. They can't trust cops sometimes. They can't trust the government. And so acknowledging that and really having both of those conversations, because a lot of times when we talk to folks about the vaccine, it's like, it's not just the vaccine that is in this conversation, right? People don't trust the system. They don't trust this, they don't trust that. And that is very valid. And a lot of times people have had to make these types of decisions, and fend for themselves and, because to protect themselves. And we really do have to acknowledge that these are things that people have to do, because some people are living in situations, where they can't just so easily, have access to go to the doctor and trust them. Some folks have never seen a doctor, or if they have, they've been disrespected, they've been, dismissed. So it's acknowledging that and getting to that other part of the conversation and going deep there and acknowledging the part that, folks like us, or folks, people with the white coat, people with the badge, acknowledging that as we have these conversations to really talk about how we can build trust in communities and how we can actually get through this thing.
Thank you, Dr. Watkins.
I think Dr. Watkins said it right, because it's very important that you have that trust. As a physician, you can say whatever you want, but if they don't trust you, nothing is going to happen. So that's why I think involving the pastors, the ministers, in their communities really makes a big difference.
One of the things that Dr. Watkins, you hit on, and I think this is something that COVID has brought to light, and Nurse Plunkett, you talked about it too, but just the inequities, just even not even believing people of color when they talk about the ills that they're facing. And I think now we're starting to see a change. But if you were to just share information with your peers, your medical professional, what can we do to change this so that we could have more trust, but also prioritizing communities of color in medical care? What work needs to be done?
I think that's the space of health equity. I think that's where it fills in, right? And I think people classically, or before this pandemic, people have looked at that work as, oh, like do it if we can, or like sprinkle a little equity on it, put a brown face here or there. But honestly, we're living with these systems that continually fail certain groups, right? We live, New York City is a predominantly minority community, but somehow all of these healthcare outcomes are negative in these large groups of the population. And we're working with not a full deck of cards. Health equity is a way that we can actually acknowledge these issues and put the work and the resources to actually prove to communities, build that trust and prove to communities a commitment to actually doing that work, to know that some people need different ways of communication, they need different forms of engagement. All of that is part of it. And I think health equity is a big thing. And having, making these declarations, the city of New York has declared racism a public health crisis, and part of our work in the health department is to actually go through and get some of the root out some of that stuff that is set up our systems against communities, and to stop blaming communities and pathologizing communities and blaming them for something that is not their fault. It's something that that the system has failed folks, and using people first language, acknowledging the complexity of people and the fact that people, regardless of their educational status, are able to be subjective. They're living in the world, they're seeing things too, and they have opinions. And I think we have to acknowledge that and, meet people where they are and have some humility when we have these conversations. I think that's a step.
Powerful. Dr. Mendoza, you were going to add to that.
Yeah, I want to say that, health equity and healthcare equity start with equity. And as doctors and nurses, we're pretty comfortable in healthcare settings and in clinical settings, but I think we also have to recognize that we all have limitations and blind spots that we can't be expected to know. And that's why we've got to work with people in our community who are not in healthcare or who are not in public health to really address equity. We can talk about the workforce in healthcare and it doesn't look like the patients we serve yet. So we've got to diversify the workforce, but that's not going to happen tomorrow, or it's going to take a generation, and it's going to take a generation where the systems in education and in housing and in transportation and in food are equitable. And that's an area where doctors in healthcare don't do a great job. And even if we could do a great job, we're probably not the right people to do it, because we need to be in the hospitals and healthcare settings taking care of the sick people. There are a whole host of people working in our nonprofits and our community-based organizations who not only do this, but do it better than hospitals and doctors. So we've got to work across the aisle, the big aisle, and be a little humble. There are certain things that we can do as medical people, but there are a lot of things that we can't. But at the end of the day, we don't have healthcare equity or health equity unless we have equity.
Thank you. First of all, Dr. Watkins and Dr. Mendoza, that you bring very important parts. And I just want to say that this is why the Urban League is here today, because if medical professionals have not gotten it yet, the Urban League is your partner, because we are trusted community members. Urban Leagues, all of us are working together to get people educated and vaccinated, and we have to do things differently. And I can't say enough how grateful I am that you all are here on the evening, prioritizing regular old folk in the evening to make sure we have the information that we need. You all have very esteemed positions, and you all really have demonstrated your care and concern to break it down and make sure we understand and we get educated and we keep our family members safe. So thank you for that. let's pause. And I know we have some questions in the chat, but I do want to talk about youth because we have targeted our youth, and we have, Dr. Archer, you've already talked about you're not as concerned because the vaccine has come later, but there are some concerns that youth should be worried about if they do contract COVID. Can you talk about that a little bit?
I know that one of the biggest concerns that recently came through down the pike, and that the media made appropriate issue of it, was a concern of what's called myocarditis, which is an inflammation of the muscles of the heart. And there was a concern that it was a combination of, oh my gosh, there's kids with COVID getting myocarditis and developing an inflammatory reaction throughout the entire body. So there was a concern with that, and seeing that in kids is definitely a scary thing. There was also a concern that children were developing myocarditis following the vaccination. The good thing is, with respect to development of myocarditis following the vaccination, it turns out, no, that's kind of what just the background risk of being a mammal really is. You're actually at about 30 times greater risk of developing myocarditis from getting COVID than from getting the vaccine. So the fact that that kind of bubbled up to the public consciousness, and then people were concerned, oh, if my kid gets the shot, they'll get this heart problem. Turns out the issue actually is much more concerning if they actually get COVID itself. So addressing a lot of the concerns, and also at the beginning of this whole issue, oh, kids get colds all the time. COVID doesn't affect kids. They're not going to be sick. We've taken care of those kids. We've seen those kids. Children can get COVID. They can get very sick from COVID. The long-term effects we're still watching and witnessing, and making sure that kids don't seem to have as much of the mental fog that we're seeing that a lot of adults have, but kids can still have complications following COVID. So we don't want to ignore it or blow it off, or say just because kids get a lot of colds or they're more exposed to them, they don't get COVID or they won't have problems or end up in the hospital. It's about talking to people and saying, what can we do to protect kids? Get your kids to wear the mask. When eligible and when available, get your kids the vaccination. Talk to them about, should we go to Johnny's birthday party at Chuck E. Cheese? Maybe not, because I don't think anybody in Johnny's household is vaccinated. You might have to Zoom Johnny, okay? And so meeting parents where they are and addressing what their concerns are and giving them proper information. That's really what it comes down to. But I wanted to make sure that we address that myocarditis issue, because that's one of the biggest things that we have parents coming into our clinic, because patients are not reading the newspaper anymore, but they're reading Facebook. They're reading their Twitter feed. They're reading their Instagram. They're watching what Cardi B says. Okay, when it reaches up to that level, they're going to come and ask you those questions. Okay, should I believe Cardi B or my doctor that went to school for 12,000 years? Okay, but Cardi B said it. And it's very important to address where they're getting their information from, why they're willing to listen to that person versus this person over here. And to go back, using another great car analogy from Dr. Mendoza, if your car is making a noise, do I go to my neighbor across the street and ask them, hey, what's going on with my car? Or do I take it to the shop, to the mechanic, who that's what they do. So addressing issues like that, and again, meeting people where they are with that, is hopefully going to try to get people to be not less concerned. I'm not going to be able to take away anyone's worry, but to allow them to know when to be concerned and when not to be concerned. And when the myocarditis issue is one that just really bubbled up, and we want to make sure we kind of put that to rest with families. And getting your kid the shot is actually going to reduce their risk of getting this heart complication from COVID. You're 30 times more likely to have a problem if you get COVID than from getting the shot. From getting the shot, it's no different than just walking down the street and just being a random person on the street.
Thank you, Dr. Archer. And just to pin your point, if we have a sore throat and we're feeling sick, are we going to Cardi B?
Okay.
Not at all. She's the last person I'm going to. So I think we better see our doctor. All right, let's talk. One more last question related to youth. Are you seeing deaths from COVID among youth?
Sorry, just seeing what people put in the chat there about Cardi B and strep. That's right on point. At least with respect to the Buffalo area, no. Okay, I know that nationally there have been children, unfortunately, that have passed away from that, but at least right now, currently in the Western New York area, it's not something we're seeing. We have seen kids that have been admitted to the ICU and that have recovered. We have seen kids that have been admitted to the hospital and have recovered. But at least right now, in the sample size that we are dealing with, that is not the issue we're seeing, at least in this part of New York State. but I know that nationally there have been children, unfortunately, that did pass away. The vast majority of those children had pre-existing conditions that did complicate their case. And that's one reason why, going back to one of the earlier questions that we had brought up about people, taking natural remedies and eating well and all that. If you have good preventive care, you're already in a healthier state that will help you if you do catch something down the road. A lot of the cases of kids being in the hospital were back before we even had a vaccine for children available, for children and adolescents. So the data we're, again, looking at in real time, I'm sure will be changing in the next few months as more and more children do get vaccinated. And the kids that we are seeing that do end up in the hospital most likely will be along those same cohorts that already have some issues pre-existing before they even acquired COVID.
Thank you. Nurse Plunkett, you wanted to add to that? What are you seeing in the emergency rooms with youth with COVID?
Actually, in our area, we've started to see quite a few. Like at the very beginning, we didn't really see anything, even when you talk in terms of like being the MISC. But I literally had one day that I worked last week, and it was very early in the morning, and parents were bringing in kids, and there were 5 different sets of parents and kids that came in, and 4 out of the 5 were COVID positive. So we are seeing like some like little clusters, like groups of kids. I mean, a lady brought in her 8 kids the other day to be COVID tested, and a few of them were. So then they're like, well, what do we do? You have to treat them all like they are, and we have to try to educate them on quarantining and what it means to do. And then that thing again with the aftercare, because a lot of people think, well, I already had COVID, now I'm good, I can just go out there and be. I said, no, that is not quite true. I said, you still need to protect yourself. And if you don't want to protect yourself, protect someone else. Because I try to remind people, it's not just about getting COVID. There's a lot of things because well, why, how come I didn't get it as much or somebody got as much? There's a lot of factors that are, still being discovered and understood about the whole thing. But the most important thing is protection. How do we do that? And we're seeing it. We have had a lot of kids and some very sick kids. Now because like I said, we are a small area, we've had to send our kids out to Syracuse because we use our pediatrics unit for as a COVID unit. So we won't even admit kids in our hospital anymore. We send them to Syracuse, and we have been making a lot of transfers because we've had quite a bit of kids with COVID. So then it goes back to the education piece, washing your hands, exposure, masks. Masks are a huge thing. I mean, before there was quote unquote a mandate of masks, people were willing to, I'll do anything, I'll wear a mask. Just, let me be able to go out and get my hamburger and go out and do that. And now it's not that's not even the battle we're having. We're having the battle with the mask itself, just getting people to wear it. So one of the things I do quite often, because people understand things, if you can give them an example, I say, okay, then let's do a little experiment here. I said, if you trust me, let me do a little experiment with you with a mask. And I said, I'm going to leave my mask on and I'm going to attempt to spit in your face. And I said, let me know how much you feel coming from me. And then I said, okay, now I'm going to pull my mask down and I'm going to spit in your face again. People are like, whoa, wait, don't spit in my face. I said, that's all I'm saying. I said, you see where I'm going with this? I said, so you may not want to address the fact that a mask is going to help. I'm not saying it's the end all to be all, but it's one of those cogs in the wheel. They're going to help us get you better and get us past this.
I like the way you delivered that, and I don't want anybody spitting in my face, so definitely wear a mask, although we sometimes get those accidental spit, right? We don't want that, so I'm happy to wear a mask. But I want to bring up something that you mentioned. You talked about people that already had COVID and say, I can't get COVID. Is that true? Can you still, if you've had COVID, I'm coming off of COVID, I'm no longer positive, are they safe from contracting COVID again?
That's a short answer. You can get COVID again. Yeah. Short answer. You can get COVID again.
Sounds like at the heart of that question is the whole discussion around natural immunity. And I think we've seen a lot of discussion around this and engagement and why not this or why can't natural immunity count for my COVID safe app or me going to a restaurant. I think it's really important to understand that, things do change And, you know, looking at what happened with the Delta variant, for example, some folks who were infected with something before the Delta variant got infected again. We're seeing that folks are getting infected. It varies. Some folks, they're protected, they're like less chance of getting reinfected for 2 months, some people longer. But now what we're seeing now with the Omicron variant is that it's even less protective, this natural immunity. So when we're having these conversations, not to say that our bodies cannot make some level of antibodies that can offer some level of protection, but it's just understanding that right now with these new variants out there, we have to really readjust the way we're looking at this, you know, this risk assessment and make that calculation. And I think the conversation changes a lot in light of this new Omicron variant and conversation around natural immunity.
So if once you get COVID and now you decide you want to get vaccinated, is there a waiting period afterwards? Can you talk about that?
10 days.
10
So
days.
after your symptoms are resolved, you can wait 10 days. And then you can get it as soon as 10 days and get vaccinated. And then now, for example, folks who may have gotten Delta within the last few months, if you haven't gotten it, if you haven't been vaccinated, I would say really consider it, because this Omicron variant may actually, reinfect you, and you can get COVID twice within, 3 months. So it's just really important to understand that natural immunity is one of those tools, one of those things that our bodies can do, but getting boosted, getting vaccinated, that just raises the level of protection. And I think right now, with everything going on and all of the unknowns, knowing that that's what vaccines can do, it's like, I think it's a win-win.
That's been one of the greatest points. It's worked with a lot of families, that by telling them that when you have natural immunity, that's great. The vaccine is boosting your natural immunity. Yeah. And that has been something that people understand that. It's like, it's good to have the natural, that's wonderful. Would I like to be a little bit more? Great, jump on with that booster and do that, because that's helping what you already have on board.
Yeah, to give you an example, there was a patient, there was an employee, he was infected with COVID. And when we started giving vaccines, he refused. He said, "Oh, I'm immune already. I'm protected." But 3 months later, he really got sick again. So that's why it's important that the vaccine is very important. Just getting infected with the COVID doesn't protect you 100%.
So we've made that plain and clear. You can get reinfected with COVID. We don't know about this variant. We don't know much. So it's best, if you do contract COVID, to go ahead and get vaccinated. And so that's really important. Thank you. So as we prepare to wrap up, I just want to take a couple of questions out of the chat, but I also want you to just remind folks, we talked about the importance of getting vaccinated. We talked about how we keep each other safe. But if you can remind folks of, some of the really negative effects of COVID and why people would, because some people are afraid of the vaccine. We talked about the fear, and people said, well, I get sick with the vaccine. How does that compare? I know you've seen the vaccine affect people differently, but how does that compare to COVID? And when people are starting to measure out, okay, what do I do? Can you talk a little bit about that?
For me, when people ask me that question, the thing that people relate to the most is the flu. So I tell people, I ask them if they've had a flu shot, and most of the people that are usually asking me that question usually have had a flu shot, and they're like, yeah, and I, how'd you feel? Well, some people say, well, I didn't feel that bad. Some people said, oh, I felt a little achy, but that's it. And I said, that's kind of similar thing you may experience with the COVID vaccine. It's not unusual to do that, but what's that telling you is your immune system is working. Okay, you got introduced to something that was foreign to your body, and your immune system is kicking in. Trying to explain, to people, like if you get a little bit of a fever, or if you feel a little achy, it's very self-limiting. It's not going to last very long, if you even get that at all. The majority of people don't get anything. Some people do. I said, but it's very self-limiting, and it's no different than when you had gotten your flu shot and you said you felt a little achy and they told you to take a little Tylenol. Same difference. Or like when we vaccinate children, so they're going to feel a little bad, they're going to be crying, they're going to be cranky, they may get a fever. Okay, so kind of give them those kind of things to like judge it off of, that we're not giving you COVID, like we didn't give you the flu, we didn't give you like the measles vaccine and all that. We just gave you a vaccine to help your body be able to withstand this particular element that may come against you.
Thank you.
One of the things that we use a lot when talking with the symptoms of COVID. We try to make it relatable to something you're dealing with every day. Because you talk about being on a ventilator, the vast majority of people have never been on a ventilator. They may not have had a family member that ever was on a ventilator. That's a scary thing. You heard about it on the media. Oh my God, you're on a ventilator, you can't breathe. One thing people can relate to is, have you ever had a cough? Yes, we've all had a cough. Now, imagine you're coughing and you're still coughing, and now you're still coughing. And you know how you sometimes don't get that breath at the end of it? Now keep doing that. That's COVID. Another really good one to just kind of give people that example is, so you really want it, you want your freedom back, you want to go have that burger. How does that burger taste? How do you enjoy that? You know, do you want the pickles? Do you want the relish? Do you want the ketchup? Now imagine not tasting that burger. Okay. One of the biggest things that we've heard with COVID is just this loss of sense of taste. And one of the complications we're seeing with the long COVID in some individuals as part of that is a loss of, is a continuation of this loss of taste. I had some of my adult colleagues talking about some patients, one or two patients they had, I think there were actually two that they had discussed, that continued to have that loss of taste for several months afterwards. And it affected not just their mental health, but their physical health, because all of a sudden their diet, they couldn't really eat anything that they used to begin with. They had to incredibly modify their diet because they just could not taste anything. And it became maddening from just a mental standpoint. I cannot taste a single darn thing. And so putting that in that perspective there and just getting people to realize, look, I know you don't want to get a shot, but you've got this continued cough, you've got this continued fatigue, you've got a mental fog with it. You can't taste anything. You cannot enjoy the foods you used to enjoy. Let's put that in perspective. So which would you rather deal with? That's a pretty easy decision for a lot of people. And again, it meets people where they are. We can sit and talk about data and p-values and what's the end for this particular study, and the average person is going to kind of tune you out. When you talk about things that are relatable on a daily basis, people get it. And we don't want to scare people. I want to give them hard information. I want to give them real information. But sometimes you got to make people wake up for a second, but you need to put it in terms that are relatable.
Thank you. Thank you, Dr. Archer. Anyone else want to add to that? Well, there was a question in the chat about just debunking some of the myths about if you get the vaccine, that could lead to miscarriages, it can lead to erectile dysfunction. Can you talk about that?
I would love to jump in on that one for just a hot second, because as a pediatrician, I also work in nurseries. I can tell you, people are still getting pregnant. I have many patients, both moms and dads, that have had COVID, that have successfully conceived and brought their child into the world in our hospitals. We actually had major upticks because of COVID, because people were home and kind of bored and they had already finished watching Tiger King. So we started seeing a little bit more increase in just the number of deliveries. So it's very easy for us and then we can counter that with saying, I know you heard that from somewhere on Facebook, but currently all of the medical data show that all of those myths related to fertility, erectile dysfunction, pregnancy, and miscarriage are zero. If we don't, it's one of those, I love having a very short conversation with families about things. And I can tell them every bit of medical evidence we have right now and the anecdotal evidence I see in that nursery over there shows that it is not affecting people with that.
Absolutely. Thank you for that.
Yeah.
Any other feedback? So Dr. Mendoza, you dropped a link in the chat, and I just wanted to talk about if you could just share a little bit about the resource that you shared.
So in Monroe County, we're blessed to have Dr. Angela Branch. She is a researcher. She comes to us from, I think, the inner city of Rochester, I believe, is where she grew up. She's a brilliant scientist. She's a researcher. She's studying the vaccines in the trials that are giving us the data that you all and we all are talking about today. And she just put up a beautiful painting. One of the artists in Rochester, who's I think a budding artist and trying to do these portraits of Black leaders, they did a portrait of Dr. Branch. And in that resource, she cites some statistics, and they're not too nerdy or anything. They're pretty relatable to most people. And I just thought it was not only a beautiful drawing of a very accomplished scientist, but also very factual. And so I wanted to share that because, most of the time, we scientists, we're good at showing our papers and our data, but honestly, most people don't listen to that stuff. This is a piece of art. And it shows a Black leader who has been an inspiration to so many people here in Rochester. And I just wanted to do a little shout out to our colleague here in Rochester and get her some good press across the state.
Thank you. So I wanted to, as we prepare for our closing, I wanted to just have Dr. Watkins, because you did drop some information about clarifying the 10 days and the 6 months for the vaccine and booster. Can you just share that so everyone gets that information?
Yeah. So if you get infected and you've never gotten the vaccine before, you can get a vaccine as early as 10 days. If you've been fully vaccinated, that's 2 doses of the mRNA vaccines or 1 dose of the Johnson & Johnson vaccine. After mRNA, Pfizer or Moderna, 6 months is the earliest that you can get the booster. That's when it's the most effective. That's when you get the most benefit. It's 2 months after the dose of the Johnson & Johnson. We know, and you can switch. You can get a different vaccine for a booster. That's a question that comes up a lot. Yes, you can switch. In terms of, there were some other questions in the chat, like if you get Regeneron or monoclonal antibodies, those recommendations are different because it's a different intervention, a different treatment. If you have those antibodies, they're going to last longer, and so that's why the recommendation is different. If you receive those therapeutics.
Thank you for that clarifying for that for us. So let me just say, first of all, thank you to all of our medical experts. Thank you for spending the evening with us, the Thursday evening with us. I know you all had a long day, but you prioritize our community, and we couldn't be more grateful for that. So thank you, Dr. Mendoza. Thank you, Dr. Asamenew. Thank you, Dr. Archer, Nurse Plunkett, Dr. Watkins. I think everyone, right? Yeah. So thank you for this time. And of course, thank you to our Lieutenant Governor and to Marc Morial for being here today, and to my fellow CEOs for joining me on this important conversation and prioritizing this conversation. I want to invite Arva Rice, and she is the reason why we were able to get the Lieutenant Governor, just saying. But Arva Rice to the conversation so that she can help us really close this conversation and understand the importance of getting educated. So Arva Rice, welcome.
Good evening, everyone, and thank you, Dr. Seanelle, for doing such an amazing job of facilitating this panel. I want to quote the mayor of New York City, Mayor David Dinkins, who used to say that we are now reached the point of the program when everything has been said, but everyone has not said it. So thank you so much for the amazing analogies about not going to our next door neighbor to fix our car, not going to Cardi B to fix our lungs. And so you have given us so many great ways for us to think about how to tell the story, how to enroll people in thinking deeply about how to protect themselves, their family, their communities around COVID. We cannot thank you enough for spending this evening with us. Thank you so much to my colleagues for providing a context. We very rarely have an opportunity to come together across the state, but we are all facing this crisis of COVID. We thought we would be out of it by now, but unfortunately, with the various variants that are here, we need to still do all the things that you all told us about: washing our hands, still wearing masks, going and getting our vaccines and our boosters, and bringing other people along with us in this journey. COVID is still here with us, and we want to make sure that the Urban League is standing with you all as partners, and want to be able to use our voices as trusted partners to be able to spread the word and encourage each other to get safe and to practice good practices such that we're able to eventually combat and beat COVID. So thank you so much, everyone, for joining us, and everyone have a good night.
Good night, everyone.
Thank you. Good night.
Good night, and thanks all.
Good night, everyone. Give your loved ones, as Dr. Mendoza said, give your loved ones the gift of getting vaccinated and keeping them safe. Take care.
Take care.
Good night.
Good night.
Good night.